I bought a condo in 1987, like for $100,000. And I took a second on the condo. I got $40,000. And with that money, I started Masimo. True innovation is intuitive leaps. Changes things for the better. I had just gotten my master's in electrical engineering. I tried to confirm for myself whether the problem I wanted to solve was worthwhile. And unfortunately, most doctors I spoke with, except for one, told me, no one cares. But it just didn't make sense to me.
So back in the late 80s, early 90s, the oximetry that existed really didn't work well. As one of the competitors once commented to me, "You're lucky if it works at all."
Pulse oximetry relies on shining light through the digit or earlobe or whatever, and looking at the light that's attenuated.
You're understanding what's happening within the body by sourcing that signal from the body.
So you need a sensor with 2 LEDs at least, a photodiode that captures that data.
If there was any motion or low perfusion, the pulse oximeters at that time would drop the readings.
The most likely to be moving patients are babies. You can't tell them to be still.
Just in the neonatal intensive care unit, 12% of the babies were getting retinopathy prematurity. 2,000 babies a year in the US were going blind. Stevie Wonder is blind from ROP.
And retinopathy is kind of a unique disease in premature infants. Too much oxygen or oxygen in spurts and bursts causes bleeding, it causes damage. It can cause blindness in a lot of these babies who are born very prematurely.
So we started 1989. We had our first proof of concept that's something I could demonstrate in 1992. And in fact, we called the project Stork because it was going to help take babies home safely.
It basically perfected pulse oximetry.
What we were able to do is show with our technology, clinicians took our products, and because of how accurate we can measure on these babies, what they were able to do is titrate now the amount of oxygen they give that baby. They don't want to go too low because those babies need the oxygen. They also don't want to go too high. And implement protocols on top of that and show a magnificent outcome.
90% of the neonatal ICUs use our technology. Blindness in the NICU is almost at zero.
The best compliment we get is when people take our technology, implement a protocol, and tell us how it affected the outcomes of those patients. It's truly amazing. Dr. Granelli took our product and found a very clever way of seeing if somebody had critical congenital heart defect.
So basically, it's a disease that's typically found in newborns within the first 24 hours. And if it can be caught, it can be fixed rather than sending them home with this disease, basically.
She came up with a method by just putting one sensor on a preductal, postductal, so on both sides of the heart. So think of doing the leg and the hand, and comparing the two saturation values.
Using Masimo SET along with a structured protocol.
They immediately know whether this baby needs to go for an echo.
At the end of that protocol, it would identify and tell them they have a positive screening or negative screening.
And catch that baby before they go home and determine that there is a heart failure and it's too late.
So I was there before pulse oximetry came. We had to put arterial sticks in small babies' arteries. You can imagine how tiny, how small the arteries would be. You can imagine how difficult it was to do. Required quite a few tries on those babies. And you had to do it not once, twice, sometimes 10 times a day. When there was a non-invasive device that came in pulse oximetry, it has been a significant advance in my career in neonatology.
Going from, one guy dreaming of this to now 5,500 people toiling away. What makes me really proud of Masimo is knowing that truly, if we weren't here, some of the things that are in the world now wouldn't be around. And that's a pretty good feeling.